Hi, this is Brian Kim. I'm going to share with you this case of a patient with visually significant Salzmann's nodules. And so you're going to see the technique and how I'm able to remove these nodules. You can tell that they're not actually integrated into the corneal tissue and they're actually on the surface of the corneal tissue. And the key is to just find an area where it lifts off so you can very carefully peel the nodule without letting it affect the underlying corneal tissue. And then afterward, we'll apply some mitomycin to help reduce the risk for recurrence. So I'm using a crescent blade to just de-epithelialize the cornea just on the leading edge of the nodules here. You can see there's extensive nodules nasally here, and then there's some also temporally, and this extends inferiorly as well. You can see the vascularization coming from the limbus nasally here as well. So you can see I'm using a dry technique with a cotton tip. And again, just very carefully de-epithelializing here. And I haven't really tried to find the edge of it yet here because even though I'm teasing it, an edge is really not coming up. So I'm just being very ginger with it here. See, as I'm pulling on it, you can see I'm approaching it kind of perpendicular. Got a little bit of removal peripherally here. I'm removing the conjunctival adhesions, almost like a pseudo-pterygium appearance to the nodules, just trying to remove the conjunctival portion, which again with the blood vessels can actually exacerbate or can cause a recurrence of the Salzmann's nodule. So after that, I'm kind of redirecting towards the temporal side. You can see I'm teasing again with some perpendicular motion. I'm not cutting into the corneal tissue, but again with this kind of a blunt, kind of a scraping technique. I have the blade perpendicular to the surface. This scraping technique I think is really effective in these situations. I also do the same technique when I'm doing pterygium surgery. And so with this kind of scraping technique, you can see that I'm finding an edge all the way around, but namely in the superotemporal area, I was able to find an edge there. And so I'm going to use that edge to kind of follow along and eventually remove this entire Salzmann nodular area. So now that I have that edge in that supertemporal area, I'm just using some forceps to very carefully peel off the nodule. So you can see it's all kind of connected temporally and then now inferiorly, and I'm going around towards the nasal aspect, making sure I remove that nodular lesion completely. And that's the nodule. And now that the nodule's been removed, I'm going to start to use the burr to polish the surface of the cornea. And because there's a potential for some surface irregularity within the visual axis, I decided to de-epithelialize the central cornea so that it can kind of reset and re-epithelialize with the remainder of the surrounding corneal tissue. And so that was the purpose of removing that central epithelium in case there was some irregularity in the central epithelium. And since I've already had to remove the nodule and remove and de-epithelialize the surrounding epithelium, I've decided to go ahead and remove the central epithelium as well. So as it heals in, theoretically, this should lead to a more smooth and regular corneal surface. You can see superiorly there's intact epithelium, but that area is really not in the visual axis, and so I decided to just leave that epithelium intact. So you can see I'm carefully removing any remaining peripheral conjunctival adhesions to the limbus. So after clearing off the cornea, I apply some 0.02% mitomycin on the corneal surface, and I want that mitomycin to contact the areas that were vulnerable to vascularization and nodular formation, nasally, inferiorly, and temporally. And after about a minute or so, I take the pledgets off and then irrigate the surface of the eye and apply a bandage contact lens. So I hope this was helpful to you, and I thank you for your attention.